Okay, so your packet is going to look like this, right? And I know you guys know this, but this for the purpose of the tape pretty much, okay? Now, when we do pre-op, you have a checklist right on the front. The checklist is huge. This just happened when I took my dad to have surgery for cataracts. Y'all be thinking I'm kidding. I could not believe I was like witnessing this. So, believe it or not, everything we teach in here, you're going to see on the outside. So I still have to call the ombudsman and report it. But what you see on this list is basically seriously taken to heart. What is the most important thing on this list? When you look at this page, this pre-op checklist.
Conform consent.
Dyslexia baby said informed consent. So yes, the informed consent is the most important thing on the list. And who gets that signed?
The surgeon doing it.
The doctor that's doing it. So why I take my father for cataract surgery and the nurse was getting it signed? Swear to God. Major hospital, he's going for cataract surgery. The nurse is getting the consent form signed. You already know how this played out, right? I said, oh, no. Not only that, on the consent form was a surgery he didn't know he was having. He was going for cataract surgery. Nobody ever told him anything about glaucoma surgery. They added that on as well. So I said, oh, absolutely not. And then I tried to educate the sister and tell her that, baby girl, it's illegal for you to do this. You do know that. Well, our manager said that legal was talked to and it's okay for us. No, it's never okay. Not in Ohio, not in any state in the nation, the United States of America, you do not get the consent signed. So she said, but all I'm doing is witnessing. No, you're not. Witnessing means that you witness the doctor talk to the patient and the patient acknowledge their understanding. And then when they signed, you witnessed that whole interaction. Mm-hmm. Ain't that deep? Mm-hmm. She was like, but my manager, I said, I know, don't worry, I ain't gonna report you, but I'm gonna get your manager name and we're gonna have a problem. Okay, so please know and understand your role. Your role is to witness it, not to get it signed. Your role is also to ascertain whether the patient even understands what the surgery is. You done already heard me say a million times that we had a patient that I had floated to ambulatory surgery when I used to work in labor and delivery as an RN. And when I floated to ambulatory surgery, the patient was getting a vaginal hysterectomy. And honey, she didn't a bit more know what that was than the man in the moon. I'm like, okay, so my name is so-and-so and so-and-so, what we doing with you today? And she was like, oh, the doctor said he about to fix my periods. I'm like, wait a minute now, hold on, what? Well, okay, well, yeah, that's true. If we do a hysterectomy, we're definitely going to be stopping your period. So, well, hold up. He didn't tell me nothing about no hysterectomy. Because, no, I said when we take your uterus out, I use those words. When we take your uterus out in a hysterectomy, we definitely not about to have no more periods. She was like, ain't nobody told me nothing about taking my uterus out. I was like, oh, shit. And I ran to the doctor's lounge, the physician's lounge, knocked on the door and said, you got to come out here because this patient don't understand nothing you're about to do to her. She said, you ain't told her nothing about taking her. He was very upset, as they always are. He's coming out kind of, salty as all hell. And now he's yelling at, well, he raised his voice at me and he yelling at her. And when he yelled at her, I did, so-and-so, I told you you were. She was like, you ain't. She started yelling back. You ain't told me nothing. And like I always say, her and her uterus walked right up out that door that day. She never had the surgery. She was pissed that he didn't tell her what he was doing. This is reality. My dad had no idea he was doing glaucoma surgery. It's a very different surgery. In addition to cataracts, it's a different recovery. It's different post-op eye drops. It's a different recovery, period. I was like, you know what? this is perfect for this weekend's class. So that's what happened. Now, the other part, and they almost messed this up too. The other part is when you get informed, when the doctor gets the informed consent signed, you can't have any medications on board. So guess what they did? Anesthesia comes to see my dad. He's assuming because they have such a jacked up policy at their hospital that the nurses get the consent signed. He's assuming it's signed. He takes that syringe of his first sand and gets ready to connect the lower lock to my dad's IV and about to push it. I'm like, whoa, 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 whoa. He did thankfully introduce himself as anesthesia, which is why I watched him because I was like, okay, he either just coming to do his consult, which they all do before surgery, or he's going to give him drugs because he got stuff in his hand. And he was like, oh, what? I said, whoa, he hasn't signed the consent form yet. Ooh, I'm glad you caught me. Why? Because their protocol is such that by the time the nurse is done, they can come in and roll up and give him medication. He would never have had surgery that day if he had given him medication because it's considered that you're under the influence, right? So remember that. Please, y'all, remember that. Okay, so when we look at this page, I want to give you some more real important pre-op stuff that may not be on the page. When it comes to pre-op, we are checking if they smoke. Smoking is the #1 way to get a complication following surgery. So the other day I was working at the hospital. I'm working in endoscopy. The patient is scheduled for a colonoscopy. She tells me, and she's only 49, she tells me she's had all 3, a heart attack, a stroke, and a PE. And she doesn't say it like that, right? She said, well, I had a heart attack, and then I had a stroke, and then I had a clot in my lungs. What are all 3? What do all 3 have in common? All 3 of those. MI, stroke, and PE. What do they all 3 have in common? A clot, yep. So remember, an MI is just a clot in the coronary artery. A stroke is a clot in the carotid or the cerebral artery, and a PE, a pulmonary embolism, is a clot in the pulmonary artery. This woman has had all 3. So you know what I asked, do you smoke? Because what does smoking do? Does anybody know? It's okay if you don't. It does that, but it does one more thing that most students don't know that it does. Anybody?
It lowers something.
It activates your platelets.
Yes.
It actually activates your platelets. Now, it also lowers your immune system, but that answer doesn't have anything to do with the clot in your lungs, your heart, or your brain. So always remember to match the answer with the question. And in this case, the question was, what do they all have in common? So yeah, they all are a clot in some body part. And that's why I asked her, did you smoke? I even asked her, did she have a genetic history? Because with her being so young and clotting like this, you might be genetically inclined to clot. So yeah, she definitely smoked. She don't know more. She said she got scared straight. So you have that. The smoking is a big one. Remember that with this patient, they're going to be listening to their lung sounds because you want to make sure that they don't have a pre-existing cold or cough. That can be a reason to cancel the surgery. They cannot have a fever. They cannot have a cough. These are actually reasons why they may get their surgery completely canceled. Another issue is anticoagulants. They cannot have used anticoagulants within the last 5 to 7 days. That's a reason to cancel the surgery. What are other meds that they can't be doing?
Blood thinners.
Well, that's the anticoagulants.
NSAIDs.
NSAIDs. So you have to be specific. Your patient doesn't know what the hell you're talking about when you talk about NSAIDs. NSAIDs is Advil, Motrin, ibuprofen, Aleve, all of those, all 4 of those. Naproxen. Some people are on Celebrex, but those are NSAIDs.
More other thing, the metformin, depending on
Metformin is okay if you're not doing contrast dye.
Okay.
If it's just surgery, metformin is okay. Yeah, but the other medications are those G herbs.
Oh, yeah,
Well, they're not really medications, they're actually herbs, right? And we try to teach you the G herbs by making a joke. We say that everybody in here is an alcoholic. So we say if you go to the test and you think alcoholic beverage, gin, it's ginseng, ginger, and then ginkgo biloba. All three start with that alcoholic beverage, gin. Okay, so the G herbs, ginseng, ginger, ginkgo biloba, and then there's garlic and green tea. Nothing is wrong with none of that stuff unless you're about to have surgery. So you don't want to have been on any of that stuff within the last 5 to 7 days. Sometimes your patient may not know that they're on a blood thinner. So when you ask about blood thinners, make sure you say words like Plavix, Xarelto, Brilinta that y'all had trouble with last time. Those are all examples of what they probably know in terms of the name of the drug. Even ask about aspirin. Now, I did have a patient just the other day. She had just had cardiac stents put in recently within the 30 days. So her doctor was afraid her doctor was afraid and apprehensive about stopping her anticoagulant. So we actually did the colonoscopy, but the way it goes is we don't do biopsies. So just putting the scope through is not going to increase the risk of bleeding, but taking little snippet biopsies of tissue would. So we saw polyps, but we did not take them out. We reported it back. So that was very important, because if you have a patient who has been told you can't stop your anticoagulant, then you're just kind of ass out because you can't do the biopsies, right? But it's worthy to look inside, because maybe it would have been a situation where she didn't have nothing wrong with her, and then she gets the A-OK. But she's actually got to figure out, her doctor's got to figure out, when can she get, and one of the polyps was rather large, when can she get this taken out? Okay, so remember that even if they have some type of procedure, nothing can be cut on. So regular surgery is out, but procedures depends, but we're not cutting nothing. Okay, so you got it. Now, if your patient's a drinker, we already know what that's about. So you do want to screen for alcohol. And when you ask somebody if they smoke, remember to say marijuana, because people just don't answer correctly when it comes to that. When you ask somebody if they smoke, remember to say vaping, because 99 times out of 100 people vape now. Remember, when you ask somebody, do they drink, just ask them, I ask it a different way. I don't say, do you drink? Do you, all that kind of stuff. I say, baby, name your poison. You like any alcoholic beverage? And when's the last time you had any? And they'll say, well, I likes my beer. And I ain't drinking because I'm scared straight or whatever. This surgery, I knew I was about to have surgery. I cut all that out. And I only really do it on weekends or only occasionally or whatever. Just try to be a little bit more down to earth when you ask these questions, because otherwise you're going to get what I see every day with let me just call them Nancy nurses asking the question like, do you drink? Do you drink? Do you smoke? Do you don't say anything? Illicit. They be saying that word, illicit. I'm like, what? So you kind of got to be down to earth with this stuff, okay? Smoking, if the patient smokes, they were supposed to be taught, don't smoke in the 24 hours before the surgery. Do not smoke within 24 hours of this surgery.
The anticoagulants, how long?
5 to 7 days. Yeah, 5 to 7 days. Now, if you look at this handout, you already isolated the informed consent. What would you say is the next most important one on here?
ID band?
Yep, ID band. You better believe it, the ID band. Very, very good. Now, the patient needs to be NPO, but that has changed a little bit. So what we're seeing is some flexibility in the NPO. We're learning through evidence-based medicine that might not have been very healthy for patients going through surgery. We're seeing some doctors say they can have clear liquids. We're seeing some say, well, only 4 hours NPO. It's really getting to be quite different about the whole NPO. Expect the majority of doctors to stick with the old ways because it's hard to break old habits. So don't be alarmed if they say the patient needs to be NPO after midnight. But understand that we try to practice based on evidence, and the evidence is showing that there is no need to not eat for all those hours before surgery. We also know that some surgeries are scheduled in the afternoon. So we're trying to get right with Jesus and not starve your behind all day and night, okay? So that is absolutely changing, so look for that change. There are 2 types of informed consent that sometimes show up on your test. One is elective surgery consent, and the other one is implied consent. What is implied? What do you think implied means? What are we doing with that?
Like if something were to happen, if you were allowed to give or do something. Like if you're in surgery and you're bleeding out and you have to.
No, because that's going to be on the consent, the risk of bleeding. Implied.
Implied means that we discussed this surgery, like more like.
No, implied means this is a medical emergency and we believe in our heart you would want us to save your life.
Oh.
So you never really got consent because they couldn't, because that's how emergent the situation was. Like it would be like sad to say, but recently we had a bunch of school shootings. One of the schools my daughter almost went to before she got accepted at Spelman, she got accepted at Florida State. Huge shooting, racially motivated, everything, white supremacists, the whole 9. So when it comes to implied consent, you can imagine if you have a bunch of kids coming in shot, the implied consent is we gotta tell their mom, but we gotta save their life too. So implied consent, you just might have to just get in there and save the life and anticipate that, of course, they want their life saved, right? It's implied. So know that term. Elective surgery means if we don't do it, we could probably reschedule. It also means the patient gives consent ahead of time. So elective, it's a scheduled procedure.
Okay.
Remember timeout. Timeout is something I do all day, every day. When we do timeout, we essentially have a patient that is part of the timeout. So remember, your patient is part of the timeout. That's really important. So you have the nurses, the doctors, the anesthesiologists, and the patients. They are part of the timeout. You are in the operating room at the time. So that's important. You're not at the bedside, you are in the operating room. The patient is participating. The timeout is a legal issue. We are verifying the patient's name, their birth date, their medical record number, and probably most important of all, because this keeps happening even at my hospital, is what are we doing for you today? So if the patient said, this happened with my dad. So the doctor came up and said, okay, so we're gonna be operating on the left eye. He was like, right eye. He goes, I knew that. I'm so sorry. I know how you probably think this doctor don't know what he's doing, but the doctor had a great reputation. So I knew it was the right eye and I apologize. You are right, it's the right eye. But right and left is the most common mistake. So it could be a steroid shot. They gave it in the wrong shoulder. It could be, unfortunately, breast mastectomy. They cut the wrong breast off. It could be a knee replacement. They replace it. You would be shocked at the stuff I see. So what type of surgery, and don't forget the whole right, left side, allergies that the patient has. Then we even say, what kind of questions do you have for us? Usually they don't have any because they've already taken care of that in the informed consent situation. Part of the timeout is me, and it is so important that you know the nurse checks to make sure the consent is signed. But it's a little different now because remember when people sign consents, a lot of them are scanned. So one day we were doing a timeout. I was checking the consent before you can even touch or give the patient medicine. It was not scanned. Now I watched the patient sign it, but the scanning didn't take. So you could have a computer glitch where the scanning never went through. So don't assume because you saw the patient signing it right in front of you, that shit is gonna actually pop. One time the doctor, he didn't hit accept. He did it, but he didn't hit on the computer accept. This the nonsense.
I want to make sure it wasn't.
This the nonsense right now. That's how it's gonna be. Okay, so now you got everything that you need on that issue. Let me make sure I didn't leave anything out. Okay, let me ask you this. What is the purpose of pre-op teaching with regards to making sure the patient knows they're going to have to cough and deep breathe? What was the purpose of that teaching? Like, what did we tell the patient to cough and deep breathe, practice
To
coughing?
keep the lungs from collapsing.
Adalcttois.
That's good, but that's the nursing word, right? So make sure you know that word, atelectasis. You are trying to prevent atelectasis. And it's a little different than saying collapsed lungs, because remember everybody that collapsed lungs are pneumothorax. Collapsed alveoli, keep your A's together, atelectasis, alveoli. Adalcttosis means that the alveoli, which is the tiniest sacs in your lungs, and the important part about the alveoli is that's where the gas exchange takes place. So CO2 crosses, O2 is picked up, CO2 is dropped off, O2 is picked up. That all happens in the alveoli, the smallest sacs of the lungs. And if those collapse, think about it. If they collapse, which is called atelectasis, if they actually collapse, there's no gas exchange. So you're what? Pulse ox will be less than 90. Okay, good job, y'all. Turn the page. Now here you're gonna see basically just a bunch of what we already said, but I think what I really want you to remember on this page, which is your day of surgery nursing responsibilities, I would have to say that on your test you get asked what is the number one way to identify your patient. And remember, I tell you, don't be on that test talking about name and name and birth date, because it's going to be ID bracelet. Okay, so please remember the answer to that is ID bracelet. You see it down there as name, hospital, birth date? Nope. ID bracelet. ID bracelet is number one. Number one. Now you can add for number two either their name or their birth date. And let me tell you something that I think is worthwhile to teach you about what you do if you're going to work in this field. I take the ID bracelet, which is usually on this like long little paper. I don't put it on them until I give it to them and say, check everything. Make sure everything on there is correct, if they're able to do that. If it's a baby, obviously you can't do that. If it's a kid, obviously you can't do that. But if you can kind of have them look and verify that all this information is correct. I was glad I did that one time because the one patient she had gotten divorced, and the name on the ID bracelet was that horrible man who had beat the crap out of her for years. She's like, I got rid of his name. Can we please get that off my chart? And Frankly, it did delay the surgery a little bit, but we got it off and printed a band that she was comfortable with. So don't assume that the ID band is correct. It may not be. All right, so that's that. Okay, so that paper is not a whole lot. You can just see it talks about pretty much the same thing, different day. What I want you to do is, let's see if there's anything. Oh, do this for your girl. You see on the right-hand side, it talks about remove loose dental work. Highlight that. So remove loose dental work. That is something people forget. I'm not gonna lie. So I got in the habit of asking the patient to say, just checking how it would be if we had to intubate them and how their teeth look. You are not gonna believe how many people got loose teeth. And I have seen it more than once that those get knocked out, especially with endoscopy tubing down your throat. So the teeth that are loose, ask them about loose teeth. Ask them, is there any in their mouth they can take out? And take them out. Some of the anesthesiologists want the jewelry removed. I had a patient, she didn't know how to take it out, and I didn't either. So I had to go get special permission for this little ring that she had. Where did she have that ring at? Either here, somewhere, where she didn't know how to take it out, and I didn't either, the way it was in there. He was like, okay, leave it in there, but he told her to risk. Yeah. So, because when they're trying to save your life, let's say that you coded during surgery. When they're trying to save your life, they're going to shove hard equipment down your throat called an intubation set, okay? So, yeah, you enter at your own risk, as they say. Okay. So you know about the contrast dye and metformin. That's not applicable to regular surgery, but in the back of your mind, you just want to remember that. A lot of patients will have pre-op antibiotics. Make sure those are ready and ready to hang because they may want those given to them before the actual surgery. Some patients were taught to do a HIPAA well, we don't call it HIPAA cleanse anymore. Well, yeah, we do. A scrub, a pre-op scrub. So especially knee surgery, hip replacements, they're expected to do a scrub the night before. Okay. All righty, turn the page.